Thank you very much, Madame, for this very excellent practical example of the implementation of the safety culture and the ethical culture in the MGH and the two views of the two professions. Well, I think we are on time, which is also a privilege because I can look at the clock and we have time now for questions. So we will do in this way. We will, it was open already, but we open again and we encourage participants to write your questions, and with the help of Jim, both of us can read this. The questions will be posted and will be read and asked to the panelists. I don't see so far any questions, so we can start maybe asking questions ourselves. Jim, what do you think?
Yes, that's a very good idea. We'll start. May I ask a question myself, perhaps in parallel to the question we had from one of the attendees at the Bonn Call for Action update, and that is, what does the panel see as the main challenges, we'll call it challenges this time, not barriers, challenges to implementing your system of ethics in medicine and a safety culture in medicine? What are these chief challenges that we have to overcome? Anyone wants to start there?
Well, let's go.
Okay, Bernard.
Well, just to launch the other, not to be alone. Well, I just would like to mention that we have a fantastic opportunity was to organize several workshops all around the world. And of course, I must confess that about when we are talking about culture, culture is always also regional and national. And holding workshops in different parts of the world allowed identification of challenges and opportunities specific to each region. Well, so just for example, we arise from differences in both resources and local culture, and can influence the development of a good radiation safety culture in various ways. I mentioned lack of financial resources, but I can mention also lack of human resources, lack of awareness of doses and risk, lack of integration between radiation protection and patient quality and safety policies. I remember well in one workshop the importance of the hierarchical organizational structure. So how people feel free to raise any safety concept without fear, and sometimes it's not so easy. And I would like finally to mention the importance of education and training variability, of course. I think that the situation is quite different from one country to another.
I'll make an observation if
yes, Jim.
Maria,
yeah, Jim, we can hear you. Please go ahead. Yeah.
Okay, yeah. I think I'll make 2 points. I think I can't say what's the most important one to Jim's question, but I'll give what I regard as a very important issue in implementing an ethics framework for radiation protection in medicine. And it is that we're dealing with 2 very large cultures facing each other. We have in medicine a very highly developed culture of medical ethics with a deep literature, a deep history, and a very, very strong heritage. And we've tried to transplant a system of doing things in radiation protection into hospitals, which was, I think its objective was to try and do the right thing based on justification, optimization, and so on. And the transplantation of that hasn't been as successful as one would like. And I think part of the reason is because it was assumed to be, if you like, completely adequate in itself. The hospitals assumed they had a very adequate system for having an ethical framework and ethical conduct within themselves anyway. And I think the two never really merged well. So medical ethics and the system of radiation protection, of justification, optimization, and dose limitation, with the exception of dose limitation, they haven't really been as successful as they might be. And I think in part, it was the reason has to do with the big effort that's required from both cultures to recognize each other, value each other, and try and integrate. And I don't think that has ever been undertaken as a project, possibly until the present work in IRPA on trying to look at safety culture. And I would regard the ethics of, if you like, behavior may contribute a lot to that, or it may be a slightly separate strand. But one way or another, I think it's in the same vein. So I'll stop there. I have another point I may make later if you run out of talk.
Thank you. Madan, I think you had a point to raise as well.
Yeah, I'll be very brief. Whenever we talk of harmonization, there is a lot of threshold to be crossed at the level of individuals who want to exercise individuality. And that is what creates the need for huge actions. So I don't know if how to create a balance between harmonization and individual considerations.
Thank you. Marie-Claire, you're on mute.
Sorry. Yes. I think that these questions that we mentioned in the medical aspect, that is to take into account the preferences of the patient, and so I think that we have to maintain also in a different field, because you have a different point of view, as Madame Reani said, different preferences really, because we have a level of something that is obviously clear, but we have some difference nuance in this. And I would like to launch another question, if it is possible, because since in the task group we have a lot of discussion apart of the main core values that was mentioned, and also by Jean. We know very well beneficence, prudence, justice, dignity, and so on. We discuss a lot about additional values too, and we introduce as additional value, but under discussion, precaution, autonomy, empathy. Jean Maloney, in his experience, already introduced others. What is your personal view regarding this? Do you have something to suggest to us to contribute to your view? And maybe yes, Malone and Maria already are involved and know the discussions that we have, and also the participant, if they have some idea, their preferences, in order to say, wow, I think that this value is very, very important for this. For me, for instance, empathy. I think that empathy is something that have a value all over the different application, but in particular, if you have a patient on anybody, for instance, in emergency also, with some delicate situation.
Thank you, Marie-Claire. I think, Debbie, you may have had a point you want to raise on the general challenges, and then perhaps we'll come back to answering Marie-Claire's question after.
So I think we have to have this professional ethics and this individual ethics in place before we can move forward with strengthening safety culture. There's an assumption that people are ethical when we talk about safety culture. And I don't think that that point should be remiss in the fact that all of the stuff we're doing on safety culture is making the assumption that people are good and people are ethically going to do the correct and right thing. In the framework of safety culture, there are some that are more important than others of the 10 traits. And I'd just like to bring to the attention of the audience here the 3 that we think may have the most value in improving safety culture. And that is, of course, leadership. They're very, very, very difficult for us to move forward without having supportive leaders, because they hold the purse strings. They're the ones that will make sure the resources are available. The second one is individual responsibility. Some way we have to make sure people are accountable and responsible for their behaviors. And the last one is effective communication. And in the study, in the meeting we had in February of last year to go over the training material, communication became more and more prevalent as the driving force in order to getting collaboration and getting people to work as a team and to see the value of teamwork in improving safety culture. Thank you.
Thank you, Debbie. We only literally just have a couple of minutes left of this session. So Jim, would you like to at least attempt to answer Marie-Claire's question? And then we'll have to wind up.
Okay, well, I'll maybe make a comment on Debbie's question, and I'll just give my preference to Marie-Claire's question, that in terms of the additional values, I think all of the values that were mentioned at the WHO workshop, which I listed in the presentation, I think all of those will be important on some occasions, but there'll be many occasions when the set of 5 or 6 or 7 that we're working on will be enough, and we don't need to look at the extra values. So I think occasionally we have to look at a lot. If we have to pick 2, I would pick solidarity and empathy as the 2 most important to add. And on Debbie's observation, I agree. I think one of the areas that we need an enormous amount of work in the radiation protection professions is to have a sound, widely agreed and widely literate professional group in terms of the values we're working out of. Because otherwise, as I said on other occasions, Homer Simpson's values would be good enough. If the individual set a survey done by the AAPM about, it's probably 7 or 8, maybe even 10 years ago now, found that less than 50% of medical physicists in the US ever encountered an ethical dilemma in their workplace. And that means people are just not sensitized to ethics dilemmas. If you work in medical physics, you will meet an ethical dilemma every week, and it will generally sort it out by reference to an inappropriate recommendation in a code of practice. I think the awareness and adoption by professions of a professional ethics system is hugely important, and we don't have it.
Thank you, Jim. Maria, would you like to then just conclude this session as chair?
Yes, of course, Jim. It's a pity because it's a very interesting session. We could continue, but we are on time. No, I think it was a very nice conclusion, the last comments, because we are coming to a similar perception in a way that a lot was done in the area of understanding the importance of ethics, the culture of ethics and respecting ethical values, and also safety culture. But still, a lot has to be done in terms of sensitizing the medical community, the health workers, which probably is not the case in the nuclear industry with safety culture, but yes, in the medical sector, and how to sensitize them to understand that, as I think one of you said, probably Jim said, this is a new paradigm for many of us, but this is also something ordinary, practical, and that we find every day, but sometimes we don't know. And this applies to ethics, but also to safety culture. Very often we receive in the workshops with in different regions, we heard, no, we don't have errors here, or we don't face ethical challenges. So I think a way that we could conclude here is probably that we need to continue working together on these topics, but we need to create more awareness and conscious that this really is relevant part of radiation protection in healthcare, that we need more social science to support this. I am not sure if we have the necessary workforce in radiation protection experts, and is relevant for this Congress, but I leave this to the president of IRPA now in the group. But I think it's probably a challenge for IRPA, for all the organizations that we are here to create this awareness in the future. From my side, I am really happy to see the progress we have done, but also the next steps, lot of to be done, still to be done. So from my side, I thank you all the speakers. I will give the floor to you, Jim, to close the session. But again, thank you, IRPA, for inviting me to chair this really nice session. Jim, now you can close.
Thank you, Maria. Thank you, everyone. And thank you all who have attended and listened to this live session, which of course will still be available online for another week. So hopefully you can enjoy the rest of your day, the rest of your night, if it's already nighttime. And thank you. And we'll close that session now. Bye-bye.
Bye-bye to everybody. Thank you.
Bye. Bye.